Namaste and welcome to the next episode of Clinical Ayurveda. Myself, Dr. Mayuresh Shakte. We were discussing Pranavasrotas, and in that regards, I have discussed with you the disease Rajayashma. The symptoms which are mentioned in the text, like Tirup, Shadrup, Ekadasha Rajayashma, are well described. There is no any doubt about it. But I have put forward in front of you my opinion regarding the Manasa Lakshana, which patient dreams or the psychological factor of this Rajeshma, and I have hardly seen these symptoms which are described in details in the text, but I have not found them in the clinical practice. If I will be happy if you share any such symptom if you have seen specifically significantly in the patient in your practice. Second symptom which I have seen in the patient was also Parshvaveda, and there were no symptom of any pranavasotas like Shwas, Kas, Thivan, Pratishay. But after some time, they developed these symptoms, and the starting was Amsa Parshvaveda, and which is very difficult to diagnose in early stage as there is no symptoms of pranavasotas. But the symptoms mentioned in the text, this symptom is specifically I have seen in the patient. The third symptom which we have written in the examinations many times, that balam tasya vid balam, that there is dhatukshay and the patient survives only on the purisha. Hence you have to make sure that purish there should not be any atisar or viration should be avoided. This symptom also I have hardly seen that patient is having Purusha Sanchay, and if given any purgative, he collapses. So, this I have put forward as my questions, and how I interpret this Balandasavid Balam in my practice. I will discuss this in today's episode or today's lecture. So, Balandasavid Balam, and they have given comparison that Jirnadvana Rajayashma. In Rajayashma, Bala is depending on the Purusha. So, if you give viration and patient collapses, then by Upashanusha you can diagnose that it was Rajayashma and there was no Jirna Jwara, etc. etc. So, when I am seeing this Balam Bilam symptom, how I apply it, I will put forward. Whenever there is Dhatukshay in the patient, maybe Rajayashma disease as such, or in the case of any malnutrition or any disease, for example, cancer, you find that patient deteriorates day by day. In such patients, in spite of any diagnosis, it is a Rajeshma or it is a plain malnutrition Dhatukshay or it is a disease like cancer, anything, whenever I saw Dhatukshay, the deterioration of the patient day by day, and Dhatukshay is also increasing, I do not prefer to give any viration or anuloman in such patients because this balam jasa vid balam. Now, patient if complains about the constipation, still I have to convince the patient that at present don't go for or don't get insist for the purgation or anuloman viration whatever it is. We will have to be patient for that constipation symptom, and I try to manage this symptom by ahariya dravya like taking milk in the night, hot water milk, etc., or taking black grapes soaked in the water, which are anuloman in action. So, Balam Dasavid Balam, as taught in the practice, that if you give viration, diarrhea and patient collapses, and I have not really seen, but I apply this that avoid viration or anuloman in the such cases when there is a deterioration of the dhatu and patient is sinking down. Another interesting fact about the treatment in Rajayashma, that there is dhatukshay and dhatuni mandya, upalep in the srotas, so dhatuni mandya, and so dhatu are not formed. But in the treatment, they have asked to take Mounserus for balaprapti. Now Mausa is or Mausa is Mausa or Mausaras. Now Mausa is heavy for digestion. So does it mean that Jatharni is in a good position in the Rajeshma, but Dhatuni are not? If Jatharni is in a good condition, then Dhatuni are dependent on them. So this factor is also interesting factor which is explained in the text, and it also adds to some confusion in my mind that how you can relate this Mausa Sevan, Jatharni and Dhatuni Mande. Another trend about Rajayashma, especially in the Pratilom Rajayashma, where there is Shukra Kshay first, then Majja Kshay, and then Pratilom Kshay, all of you know. Many Vaidya relate it with the HIV because the HIV starts from the Shukra Dhatu, and then gradually deterioration of the patient starts. So in that case, you have to deal with the Shukra Dhatu also as a major cause of the disease. This is a trend which I am mentioning in front of you. By modern science, we have a comparison or very much similarity of Rajeshma with the tuberculosis of the lung, both symptom wise, intensity wise, severity wise. So that comparison is a little bit easy, but you have to consider also other tuberculosis like tuberculosis of spine or bone or tuberculosis of intestine. In that case, the mentioned symptoms in the text about CASA etc. you will not find, and you will find symptoms of that organ like bony pain etc. or in the intestines. So you have to interpret these two diseases which are told or seen in the practice in your or in our Ayurvedic way of Samprati, and you have to deal this patient, treat this patient according to the Samprati you have interpreted by Ayurveda. So this is about the Rajayashma, interesting things which only I have specifically mentioned. Other symptoms, Hetu, etc., you can go through them and even treatment part. The interesting thing which in the Hetu which is told as Vishamashana, Vega Sahasa Vishamashana. So in Vishamashana it is expected that irregular habit of food, but in practice you will find this Rajeshma with good quality of food habits, good lifestyle also. So it is very difficult to point out which factor is causing Rajeshma in that patient, which lifestyle is not weird and it is no any habits like alcohol or smoking, and still I have seen the patients with good lifestyle, good food, quality of food and good lifestyle have got such disease. Now again I will not able to answer why it happened and what was the cause in that patient. There are no Vega Road, no Sahas, no Vishamashan, all these reasons. Still people you will find have got the Rajeshma. So this is about Rajeshma, and I have only pinpointed the facts which I have not clear and understood or which I have not seen in the practice, and some queries about Rajeshma like Yatharni and Mausara Sevan and Dhatharni Mandya etc. I will be happy to have your opinion on this and your experience to share with it. Thank you very much.